The fear of waiting a day or 2 days for a test result can honestly be pretty crippling for a patient, especially when you're going home, you have other loved ones, you're not sure if perhaps you could be exposing them.
It was difficult to go home at night and take care of your child, not knowing if you were passing something on to them or to your spouse, and also not knowing if you spiked a fever, if you were going to be able to read them a book the next night.
If patients could be quickly given the information that they were either positive or negative and given instructions based on that, that would be really an important advance in the way that we're doing things now.
I'm an emergency physician here at Evergreen Health and also president of Evergreen Emergency Services. In late February, our infectious disease specialist actually discovered a couple of the first cases of COVID.
And initially we became kind of the canary in the coal mine for the entire United States health system.
The criteria to test people were fairly limited. I believe at one point we were running as few as about 12 tests per day.
Currently for testing, we use an NP swab that is like a little brush essentially that goes in the back of the patient's nose.
Back to the throat, and then we rotate it for about 15 seconds. It's not a comfortable experience.
They usually have a tear in their eye, actually. I mean, it truly hurts, yeah.
It actually aerosolizes virus. You can imagine when you do that, people cough and sneeze. And it's actually a risk to the staff and to the patients that come into the room next.
That test is then either sent to our lab or it's being sent to the University of Washington where they are able to run more tests per day. We usually have about now 1 to 2 day turnaround.
We were approached by Q a couple of months ago to help them do an investigational trial around a cartridge that actually tested for the novel coronavirus, which is the source of COVID.
This is a handheld portable testing device that can be ran primarily off a battery. It links up into your iPhone. The test itself is less invasive than the nasopharyngeal PCR.
So the nice thing about the Q device is that the swab is just nasal. It goes perhaps a ½ inch to an inch into the nose. It gets spun around in each nostril for about 5 seconds. You get the result in 30 minutes or less. It's much more comfortable for the patient and actually safer for the staff. When the swab actually goes into the cartridge, it locks in. So theoretically, the virus is now inside the cartridge and the swab can't be removed.
I mean, the reality is it's such a simple test. It doesn't require any medical knowledge or sophistication in how to do it.
The combination of the safety profile and the speed of the result should make it a winner in the marketplace.